There was a lot of concern about whether GLP-1s were causing thyroid cancer, right? Because the preliminary data showed concerns for medullary thyroid cancer in the animal studies. There was no preclinical data for the most common form of thyroid cancer, which is the follicular and papillary thyroid cancers, which are the ones that are increased risk for patients with Graves' disease have an increased risk for. In the post-marketing observations, what we saw was an initial, like if you start GLP-1s, there's actually a signal for increased thyroid cancer in the first year after starting GLP-1s, but not 5 years later. And if you think about it, if you start a GLP-1 and you find a cancer within a couple of months, it can't possibly be from the biology of cancer that cancer is related to the GLP-1s. And what it turns out is that it's all surveillance bias, right? Everybody's worried, oh, I need to think about thyroid cancer. I just started a GLP-1. Everybody's getting thyroid ultrasounds. And so there's a huge increase in thyroid cancer detection that's observable in the literature in that first year after people start GLP-1s. But if we look 5 years out from starting GLP-1s, there's no evidence that there's an increased risk of thyroid cancer. And so it's not considered a contraindication to being on a GLP-1 that you have thyroid disease or that you have even that you have active thyroid nodules. It's, or even a history of thyroid cancer. It's only the medullary thyroid cancer that's associated with it. So in general, if people do gain weight and that's something that they've discussed with their primary care doctor that they want to consider, it's certainly reasonable.